There are 55,000 people with dementia in Ireland, a number set to more than double in the next 2 decades. Approximately 50,000 people are carers, and the true number may be 3 times higher. Dementia is a progressive condition and as such needs different responses from the time of the initial diagnosis of the condition right through to when a person dies. It's possible to live well with dementia, especially at early stages, where a little support goes a long way. As you know, the progression of dementia can take decades. At the advanced stages, people and their carers need a lot of care and support. So like other long-term chronic conditions such as strokes, heart disease, cancer, dementia is a condition requiring special attention and its own claim on the public purse. I'm co-convener of the All-Party Oireachtas Group on Dementia with Deputy Mary Butler, TD, whose membership includes Senators Devine, Hopkins, Humphreys and Byrne, all active members of this House. In Budget 2019, there was an opportunity to put real money into the range of supports that people with dementia and their carers need to live well with dementia and to die well too. Firstly, the Government could prioritise closing the dementia gap revealed in the HSE mapping exercise published earlier this year and broken down county by the Alzheimer's Society of Ireland. To give just one example, my native Cork, there is about 4,000 people with dementia, 12,000 carers, and to bring people living with dementia to a minimum level of support, there needs to be an investment of about 500,000. Secondly, the Government should be investing in developing a national network of dementia advisors. A recent evaluation published by the HSE and undertaken by UCC wholeheartedly supported the development of such a network embedded in primary care. Deputy Butler and I saw such a network at first hand when we visited Scotland. Currently, we have 7 dementia advisors nationally, but we need about 90 to have one in every primary care network. If Scotland can afford such a network, providing invaluable support at the point of diagnosis and beyond to people with dementia and their carers, then why can't we have that network in Ireland too? And finally, we need to shift away from total reliance on residential homes for long-term care for people with dementia and develop home care as an alternative and a complement to nursing home provision. When asked, people themselves and their carers say time and time again that they prefer home care over a nursing home, but home care is just not there. Due to lack of home care, people can't be discharged from an unsuitable hospital bed, which costs the state $300,000 per bed per year, plus. We also spend £1 billion on long-term residential care in this country. In Budget 19, we could allocate resources, a down payment of 100 million new money on home care. So I was disappointed that dementia was not mentioned specifically in Minister Paschal Donoghue's budget speech, although I welcomed Deputy Barry Cowan's response in the budget debate for significantly increased home care packages, funds to develop a national network of dementia advisors and the expectation that we might see specific commitments on these in the HSE service plan. So I asked the Leader of the House if he could invite the Minister Harris or Minister of State Jim Daly to make statements about what resources exactly have been set aside in Budget 2019 to fund closing the service gaps for people with dementia and their carers in every county in Ireland, to fund the development of a national network of dementia advisors and to fund a significant investment of new money in home care, and for the Minister to put on record that all of those specific commitments around dementia will appear prominently and clearly in the HSE 2019 service plan. I would also like to mention that tomorrow is the 3rd anniversary of the fire in Carrick Mines, and to pay respects to those who perished in that fire. Thank you.